Welcome back to Medicine Deconstructed. I'm your host, Dr. Jay Rutland. Ding. You guys heard that airplane ding. It's a very familiar tone. The other day we had an airplane medical emergency. So what do? Let's talk about that right now. I fly a lot. All of you know this. In fact, in 2023, I flew 200,000 miles on Delta. But on a Southwest flight recently, while in the air, the ding went off, looking for a doctor on the plane. As a pulmonary critical care physician who deals with critical situations on the daily, I'm equipped to help. I said, sure. So what did I do? And how did I decide to answer the main question from the pilot, do I need to land the plane? Well, it was an elderly female who recently was in a car accident. I obtained the history from her and her husband. She had fractured ribs, causing a pneumothorax, necessitating chest tube placement. Other than that, it was just little trauma. Her chief complaint on the plane was shortness of breath, but throughout her conversation, she said she was getting better. She was on oxygen, as that's easy to get on the plane, but I had to perform a physical exam to see if any other vital organs were acutely damaged. I listened to her heart to make sure there were no murmurs. There weren't any. I felt her pulse to make sure it was bounding. I also listened very carefully to her lungs, which had bilateral breath sounds. My decision at that point in time was that we could keep flying to our destination. When you're on board an aircraft, yes, there are certain requirements for medication kits, but flying in the United States and experiencing this firsthand, the kit's never completely full. That's for another future episode, not for this one. But on the plane, when I'm looking at a patient, what do I assess? I assess airway, breathing, and circulation. When I arrive to the patient's seat, if they're awake, I'm going to ask medical history. I then do the ABCs. I assess the airway, I assess the breathing, and I assess the circulation. If all of that is good, I tell the pilot we can proceed to the destination and deal with anything once we land. If the patient doesn't protect their airway, or they're not breathing, or they have a low blood pressure or low heart rate, I tell the pilot they got to land now. Obviously, if I feel the patient is having a heart attack or a stroke, the pilot has to land as well, because time is brain and time is muscle, the heart. I believe that airlines need to do a little bit of a better job of making sure the medical kit is up to speed. There's an emergency in the air, I think one out of every 20,000 passengers that fly, so this isn't an uncommon thing. In fact, the Federal Aviation Administration requires commercial aircraft to carry at least one sealed emergency medical kit containing a minimum of 25 specific instruments and medications, plus first aid kits and automated external defibrillators. But the FAA leaves it up to the airline to refill the medications or supplies if they've been used. So we got to do a little bit better right there. My advice, if you're a patient, know your medical history. But if you're a doctor on the plane, if you volunteered to help and you're in doubt at all, just tell the pilot to land the plane. Thanks for joining this episode of Medicine Deconstructed. We'll see you next time.